Neuromuscular re-education with a REACT bioelectric magnet is what we're talking about here. So there are various ways to do neuromuscular work. This table, which you're going to see in a moment, you'll see a video, is a magnet therapy that stimulates nerves and muscles as opposed to pads on your body. The idea is you're depolarizing muscles and nerves, you're stimulating muscles and nerves. Let's say, again, we're going to talk about back, so let's say it's your back, right? We're going to stimulate this area, contracting muscles, firing nerves. It's going to increase the communication back to the brain and then brain back to the area. And it's going to increase blood flow because we're creating muscular effort. So it's going to attract blood flow to the area to enhance healing. Of course, that's the goal with lots of therapies, chiropractic, physical therapy, exercise, massage, and so forth. This one is a bit different because it's a magnet that's generating the neuromuscular activity as opposed to an electrical pad or other therapy stimulations. So in this video here, you're going to see I'm lying on the table. And I'm actually treating my lower back. So you can see the nice flat table. The magnet is underneath the surface of the table. And the beautiful thing about that is I can move it around to different body parts. We can work on everything from the neck to the feet and all the joints in between. So I work on neck and shoulders, elbows, wrists, hands, middle back, lower back, great for hips, knees, feet, muscular issues, and so forth. So you can see in this video, I have it right underneath my lower back. And if you look carefully, you can see the muscles pulsing in my lower back as that magnet is sending the impulses in, contracting the muscles, activating the nerves, and creating that activity in the lower back. Now the beauty of this is there's nothing to be attached to, so there's no pads, no wires. The next thing that's beautiful about this is you can see you can just hop on the table, fully clothed, okay? And it has a very deep penetration. Depending on the body area that we're working on, it can be up to 4 inches deep in its penetration. The frequency can be varied and the power can be varied on this table, on the REACT table. And by the way, we'll be putting up the website here so you can look into it more if you want. reactinnovations.com, reactinnovations.com, and there's a great video there on this simple website, and there are nice short explanations on how it's worked and the applications and the contraindications. So the reason I'm on here is I want to take a moment and talk about the lower back. So I've talked about my lower back a lot. I've had off and on backaches for 40 years. The first time I have had back pain, I was 15 years old, working as a dishwasher in a restaurant, bent over a low sink, washing pots and pans, getting back pain. And I started realizing I had to change my ergonomics and positions to reduce my back pain. Well, that didn't cause an injury, but ever since I've had off and on backaches. If you make me sit for a long period of time, my back aches. If you make me stand in one place for a long time, my back aches. But if I'm moving around, I'm pretty good. If I'm stretching, I'm pretty good. Working out, I feel good. Ride my bike, I feel good. Running is good. Lifting weights, good stuff. If I'm moving, it's great. Not everybody's lower back is like that, but I'm giving you my scenario because a lot of people are. What I have found since I've had this REACT table for the past year is it's adding rehabilitation for my lower back. My lower back, particularly in the past couple of months since I had a flare-up, is doing much better by doing that therapy that I showed you on the video. Adding that impulse in there with a little bit of core work and a little bit of pelvic tilting while I'm on the table has worked magic. So some other applications for the table, I want to give you one more before we close up here, is I have a man that's coming in. He had a bad car accident with a serious knee injury, and he needed some surgeries and hardware in his knee, and now his knee is completely straight. So he can't bend his knee. And when you can't do that, you're not going to be activating all the muscles in your leg appropriately. So all of his muscles have atrophied in the involved leg. What we're doing now he does need some additional surgeries, which he hasn't had yet because of COVID, but they're coming up. So we're doing prehab on him. He can't contract the muscles on his own very much because he can't bend his leg. So he can't do typical gym exercises. So I put him on the table and I'm activating all of the muscles in his leg to strengthen those up, increased blood flow, increased nerve activity from the leg to the spinal cord to the brain and back through the spinal cord to the leg. We're getting this leg in the best shape possible before additional procedures. Wonderful application for this. And as you're going to read on the React Innovation site, one of the biggest applications here is athletics. So a lot of athletic teams are actually getting tables, and their therapists and chiropractors are using this on athletes. As a side note, the first generation of this technology was a chair. You can go to this, and the chair was designed for pelvic floor rehabilitation for urinary incontinence. So they built a chair. You'll see it on pelvicwave.com. That's the chair you're going to see. And it was a stationary chair. It looks like a living room chair. And you just sit in the chair. The magnet, it was stationary in one place right underneath the pelvic floor. And it contracts the pelvic floor muscles and stimulates the nerves. So you get this massive, like Kegel on steroids, thousands of times per session to increase that pathway, increase the strength of that pathway. Many, but not all, people notice great improvements with pelvic floor issues, men and women. So that was the first generation of it, and these smart technologists and doctors and researchers said, it's so good for the pelvic floor, how can we do it for the rest of the body? Hence the table called the React table. And I can do the pelvic floor on the table. People sit at it. I've done videos of that on the past. So there we go. If you have a lower back issue, an acute issue, it works for acute problems, lower back and other joints around the body, or a chronic problem that hasn't responded to other types of care, take a look at it. It's working for me. I'm Dr. Scott Fuller.